Thanks for joining me for this episode of This week, I'll be discussing the stop, start, same step of the population health cycle. Last week, we discussed the score step. Obviously, that step shows you the results that you've achieved by the various interventions you did. Now, what do you do with that information? Well, this is a continuous quality improvement process. So the data from the score section is used to revise your program as well as report your outcomes to your client. Some of what you did achieved the results you expected, other efforts did not, and some might have exceeded your expectations. In this step, you used the data to revise your program. Those activities that did not achieve results may be stopped. Others that worked, you keep the same. And finally, here it's an opportunity to add new activities to your program. These you start. That's what the stop, start, same step is all about. As an example of this, we discovered in the HIV/AIDS program that individuals were being discharged from correctional facilities, gaining Medicaid, and then coming into the program, perhaps with no physician to go to and a small brown bag of a week or so of their medications. Given the nature of the data exchange, we were notified of these new members perhaps a month or two after they had been released. We spoke with the state and met with the Department of Corrections. Through these meetings, we identified a way to introduce ourselves prior to the individual's release and assist them with their transition by arranging for them to see a physician and get their medications, as well as providing education and other care coordination as needed. While most people think of the stop, start, same change step as one done at the end of the year, this step can be done anytime during the year as the data is analyzed. Here is another example. In a new program for a condition we had not previously worked with, our staff came to us and stated that the ratios we had developed for this new offering did not allow them to achieve the results they were hoping for. So we reviewed the data, revised the ratios, lowered the number of patients per RN and CHW, and added staff. Interestingly, this was a fixed rate contract, but we recognized the importance of this change for our staff and the patients as well as the client. Another area to monitor for the stop, start, same change step are the evidence-based guidelines for the disease state or condition you are working with. Obviously, as these are modified, you will modify your program and measures. Measures or actions that are discontinued are stopped. Those that are new are started, and the others remain the same. So there you have it. Stop, start, same. The final step in the population health cycle. It's a continuous loop which is now repeated. Now that we've completed this series on the population health cycle, look for the next episode of on other topics associated with population health. Thanks for joining me, and if you'd like more information, need help with your program, or would like a review to determine your true results, contact us at info@accountablehealthllc.com.